So we're here at the Monroe Institute for the Professional Division meeting, and I have Dr. Sergey Sorin, Dr. Norm Shealy, Gari Carter, and Dr. Brian Dailey here with us today. Gari, you were here this week with us, and you were one of the keynote speakers about your experiences with using Hemi-Sync during multiple surgeries that you had to go through. And I was most inspired by your story, and I want to hear more about it from you.
Well, thank you. I appreciate that. In 1982, I was in a car crash, and the steering wheel got in my face and the engine got in my legs. My face was a hole from the eyes down, and I wasn't expected to live because of all the multiple injuries, but I did. And then I had to have 10 years of surgeries after that to reconstruct the face. Things were incredibly painful. I had no idea at the beginning in a coma where I was or what was going on. And then when they started, they first worked on the jaws and refracturing both the jaws and making them meet and starting to shape the lower part of the face. I didn't realize when they work on a face they have to start on the inside instead of the outside. So it's like building a house. You have to have the platform and the foundation first. But the first surgery was incredibly painful, and I just thought I was never going to make it through this. And after that, this very pushy friend called me up and said she'd heard about some alternative pain control tapes that she thought might help me, since I had years ahead of me to do this. So the tapes arrived, and I was so excited to open the package, and I got one ready in my little player and laid out on the bed and listened to it. And I just felt amazing after that. I felt great, no pain. I felt full of energy, ready to take on the world. And I jumped up, ready to do about a million things. And then I was so dizzy, I had to get right back down on the bed again. So I learned to rest. That was my first introduction to Hemi-Sync. And it has just changed my life in such a wonderful way. The very next surgery was to take out one of my ribs to make my nose. So I was going to hurt two places instead of one, and I was really afraid of that. And I used the tapes right up until the time they started general anesthesia, and was not afraid, didn't want to run out of the hospital before the surgery as I had before. And after the surgery, I was refreshed and felt okay. I used the tapes right away, never used the first bit of pain medication. Left the hospital in 2 days instead of 10 because I recovered so well. I had minimal swelling and bruising. It was just amazing. So I used the tapes a whole lot and recovered really quickly to be ready for the next surgery. And with that, I asked if I could start using the emergency series in the ER instead of using general anesthesia. And my doctor agreed. So all the rest of the 10 years were done with the help of Monroe. And it was just one of the greatest gifts I'll ever have in my life.
Well, back in the 60s, neurosurgeons were treating chronic pain by destroying part of the spinal cord of the brain. And I began looking for alternative ways of managing pain that were not destructive. In 1972, I learned about biofeedback. And so between that time and the later 70s, I began working with all kinds of chronic pain patients, teaching them to go into very deep delta brainwave activity, and learned it myself as well, so that in 1976, for instance, when I needed an operation up through my nose, I was able to put myself into that state and not have any anesthesia at all. Then I had met Bob Monroe in 75, and I got into Hemi-Sync and began using it as an addition, because to learn EEG biofeedback is sort of tedious for a lot of people. Hemi-Sync does it for you. It essentially puts you in that state. And so I did a number of patients where we would look at what happened to them in deep relaxation with the addition of Hemi-Sync.
Yeah, so I've been using it for a long time, kind of like Norm, and I found it really helpful for both myself and a lot of my patients, Sergey and I work a lot of shift work, irregular sleep hours, so some of the sleep CDs to induce sleep are really helpful, and in particular I use Catnapper a lot, which is a way to get a quick nap, something of the equivalent of an hour and a half sleep in 30 minutes to wake up refreshed. And I also found it very helpful in hospice at the end of life transition. Very often the person is sleeping quite a bit, understandably, they need it, and people are flying from out of town. This is a way for them to get a nap, get refreshed, and be able to spend some quality time awake meeting with family members. Surgical Support Series, it's got 5 tapes. There's one that you can listen to during the surgery, and it has positive affirmations and tells you, explains that the blood pressure is going to be normal and such, and it works really successfully. I actually had a friend undergoing a total hysterectomy who used it. The surgery sailed through easily, and post-operatively she had a patient-controlled anesthesia with the morphine pump, and when the nurse came in and saw that it hadn't been used, she turned to her and said, "You should be having pain. Why haven't you used the medication?" So I haven't needed it. And she kept arguing with the patient. I thought, what kind of message are you telling her? You say, "Thank you, well, I'm glad you're not. If you have need for it, there it is." And she actually took 2 Tylenol just to satisfy the nurse, which was her only post-operative medication for the entire procedure. When I was using the Metamusic with a lot of chemotherapy patients, and as you might understand, a lot have nausea and vomiting issues, and I found the Metamusic could improve the deep relaxation, helped a lot with the nausea and vomiting, and I asked Lori, I had an idea about creating a Hemi-Sync exercise specifically for chemotherapy patients, and I was hoping she'd say yes, but I was really pleased when she said hell yes, because her mother had breast cancer. And I wrote the script, Dar Miller narrated it, and we had the beta CD, the very first version, not 2 weeks. And Gretchen, who had been living in Amherst, Massachusetts, came down to Rochester to get treatment, and she had just had the chemo the day before, had been vomiting for 24 hours, the last 3 leaning over the toilet. And I arrived at her house. We did a little energy therapy over her 3rd chakra to stop the vomiting so we could get her from the toilet and in the bed, put the headphones on. 45 minutes later, she took the headphones off, and the first thing she said, "Oh, that was a great friend," and it was Dar Miller, who had narrated the positive immunity series she had done to bolster her immune system. And the second thing she said is, "I feel great," and she sat down and ate lunch. Wow. Never had problems with nausea or vomiting the rest of her therapy. We actually shortened her chemo by 4 weeks because she had such a great response. And we've seen similar things with other patients as well. So, yeah, I've found it useful in a huge number of situations.
One of the examples that really stands out very strongly in my mind is this case of a 12-year-old young man. The family came in saying, okay, he needs this and this and that, okay, and on discharge we ran out of this, so please give us a prescription. I had a little time, and they didn't quite agree with me at first, but after they realized that I wasn't giving in, they decided to give it a chance. So I sat with him and the family. I explained about the breathing, the relaxation, some of the mental imagery he was actually able to listen through despite having a full-blown panic attack. And we put the headphones on. And I told him, if this doesn't do the job in about 5-10 minutes, then don't worry, medication will be coming. Within 5 to 10 minutes, actually even less than that, I saw a big smile coming across the room. Actually, he took the headphones off and just announced in front of the family, and to me I don't know what this was, but I feel incredible. I think I can do this. And that truly is the message to me. in the healthcare system, we are used to working with patients, such as subjects. It's a passive process, and they're relying on us to fix them. You can't really fix something like this. It has to come from within. Dr. Norm Shealy is a pioneer in self-regulation, and this is what it's all about.
Both my children are in the education field, and it was very interesting because as they were starting up in it, the PAL series came out, and Barbara Bullard was developing her special meta-music for helping with autistic children and children with ADHD and various other learning disabilities. So my daughter, who specializes in the developmentally disabled, which is no longer the correct term to use for them, was working with a bunch of young boys, I think adolescent boys, as she was practice teaching. And she every day brought her boombox and brought the meta music that I'd given her. And the first day the boys all complained they didn't want to listen to any dumb music, they wanted to do their thing. It was really hard for them. They had difficulty reading and writing. And she kept on bringing the boombox for about a week, and then one day she forgot it. And they all said right away, "Miss Carter, where's that music? We can't do any work without that music." So she was convinced after that, and she uses it frequently. And Barbara talks about many, many other applications of it with other teachers and with herself teaching college students. So it's fascinating all that's developed with that. It's really changed learning, I think, in such a great way.
My wife already had a degree in chemical engineering, and midlife, age 45, is going back to college with all these 18, 19, 20-year-old students, and they noticed the old lady in the library had headphones on, and they asked what she's listening to, and she said, "Well, it's music to help me study." So she gets a 4.0 her first quarter, and now there's 6 students in the library wearing headphones. She gets her second 4.0. To make a long story short, she got a 4.0, and by the time she finished, there were 50 plus students with headphones on in the library. And talking about the PAL series, it's something that students can use, a combination of things to help, with sleep and study and such.
I was living in Florida, and I raced every week with a ladies sailing team, and one of our members developed breast cancer again, and it was terminal, and the whole team banded together to take care of her. And so I brought in Going Home when it got to the later stages. And what was so amazing is instead of a small family or 1 or 2 caregivers taking care of this person, it was 30 ladies who were all on a great computer schedule as to who showed up when, and there was always somebody there with her. So we just started playing Going Home early, and it kept everybody calm. Nobody got upset about anything. And our friend Lynn was just flying through the whole thing, just breezing along with really no pain, no concern, just very happy about everything. And the amazing part was at the very end, when she was really past talking back to any of us anymore, when she heard Bob's voice on the tape saying, "There are people there who will take care of you," she would repeat, "Take care of you," every time, just up until the very, very end when she passed. It was just beautiful, and I felt so fortunate to be a part of that. And since then, I've used it with my mother. I've used it with various dogs, cats, and rabbits, and it's successful every single time. I've passed it on to other friends, and it's just been a wonderful gift in my life and others.
Yeah, I've done a lot of hospice work over the years, and they actually have a 2-set. One is for those spouses or partners willing to participate for the healthy individual, and one for the person that's making the transition. And the difference basically is for the healthy person, there are health and for affirmations about wellness, and the one for the person that's going to pass on aren't on there. You don't want to send a confusing message, but I have about a third of the relationships choose to participate in both, and they tend to find really profound experiences. It's kind of, you know, we find death so uncomfortable. And this is a process, you know, thank goodness a lot of our hospices attitudes are changing now. Families are getting more involved. But I can think of one couple in particular who would listen to various exercises or tapes and experience it together and discuss it and what their thoughts were. And one of the thoughts is some of these areas it takes you to are areas of some real clear thinking and insight, and that you might get a kind of a little taste or idea of what the afterlife might be like. And I think that that relieves a lot of fear for people. And it's even more wonderful for the partner accompanying them because they have an idea of what the other person's going through and they're sharing with and partaking. So it can be an absolutely incredible experience instead of what we normally consider a very sad event. Bringing joy, it's always great.
I was just reminded of something else as Brian was talking too, and I thank you for saying what you did, because at the time of the car crash I went through a near-death experience, and I went through the tunnel and into a vibrant garden, and my father appeared, who'd been gone for about 10 years, and I thought, because since you don't speak there, how happy I was to see him again. And he thought back that he was glad to be with me as well, but I couldn't stay. And I was saying, no, 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 I'm not going. I'm staying here. And he said no, that I had a purpose I had to fulfill, and I had to go back and do that. And I asked what in the world it was, and he just thought I would know when the time came when I found out. And I didn't realize till I started writing my first book that that was my purpose, to use my experiences to help others. I think that's the most important thing in life, to help others. So whenever I've been with somebody who's making their transition and used going home, I've been able to reassure them that I've already been on that pathway, and I know what fun it is to die, and I will never be afraid of it, and that they shouldn't be either, because it's just such a happy, overwhelmingly happy place and happy event.
I think the most critical factor is to learn that you must take care of yourself so that you have the energy to help other people. Mm-hmm. So your primary responsibility is not to be a drag on the rest of the people. Mm-hmm. Take care of yourself first, and then you put all your energy towards it. Mm-hmm. And, you know, I've said for many years that if I were, you know, terminal, so to speak, I just want to be in my bed listening to Gregorian chants, but now I think it'll be going home.
Yeah.
But I've never feared death.
Mm-hmm.
I have absolutely no fear of it. To me, it's a perfectly normal part of life.
Yes. Well, you know, that is kind of a funny point. From the day we're born, along with taxes, you can be sure we're going to die. And we spend so much time avoiding it or thinking about it instead of planning. Last year's meeting, Scott Taylor talked about a woman he was helping who was totally fearful of death. And he said, you know, you get to have a party when you get there, and you get to choose who's going to greet you. Have you ever heard that you might have friends or family? Yeah, I'd heard that. Well, who would you want to be there? Well, I'd want my parents. Sure, who else? And he went through a litany of people. So what kind of party? And to make a long story short, she chose to have a barbecue, and it was going to be by a river. And by the time they got it became a big event. And she wound up passing a few hours later. And I thought, what a beautiful way to see the beauty of this instead of the fear of what was for her going to be an unknown.
Right, but a beautiful party. What a great send-off.
Yeah, it was, and she was looking forward to it. So
it's such a gift.
One of the other things I'd like to, I say thank you first of all for sharing your story during the talk, but also to elaborate further is it seems to me that you've taken the opportunity to go through a crisis, a very traumatic experience, and you actually changed it into a complete transformation. Something that even transcended what we'd call regular, normal existence. And there's leaps and bounds by when I say that. Could you talk a little bit more about that?
Sure, I'd be glad to. I guess what was interesting in my first life, which was very traditional and conservative, I was married, I had 2 children, I owned a clothing and gift shop, and my life was just very narrow and straight. And then after this, and I was a model from the time I was in my teens, and I was used to people looking at me with admiration. And then with this car crash, all of a sudden, when I had no face anymore and people looked at me with looks of horror, it was as if everything was just erased from what had been there before. And I realized that the values of having a successful career and a marriage and children were not the same values in my second life. I always celebrate the birthday of that car crash as my second life. But I had to change the values for my new life, and I had to really think about what I cared about with that. And so my yoga and Sufi teacher came to visit me in the hospital once I was out of the coma, and he left me with some quotes to think about. And one was, "What has happened is happened. What I'm going through I shall rise above, and what will come I will meet with courage," by Hazrat Inayat Khan. And I really thought about that afterwards, and I realized that my new life, my second life, needed to be about love and harmony and beauty and peace and helping others and more values instead of monetary and social values. It needed to be more inside values. I learned to look at the light bulbs and not the lampshades in my second life. So it really changed my whole focus, and everything I did from then on was with a totally different purpose. And it's made me different. I already was different, but now I'm really different. And I love it.
That's just along the same topics. During one of the workshops, my friend, my business partner, Brian, said, I want to invite a friend of mine that I know for a number of decades, Dr. Norm Shealy. And I said, who is Dr. Norm Shealy?
Yeah.
And then I Googled it, I said, oh, Dr. Norm Shealy. Okay, that'd be fantastic. And interestingly enough, Dr. Norm Shealy came to our workshop, and that just sparked a relationship that literally changed the entire course of my personal universe, my personal existence. But now, at this point, I know where I'm going. I'm joining Dr. Shealy, Norm, in terms of being and pursuing a truly holistic path. Thank you.
May I comment on that?
Please.
Is it appropriate? And you can decide.
Sure.
But basically, since 1972, I have explored reincarnation, and I no longer believe in reincarnation because I know that it's the way it is. I've done hundreds of sessions with individuals. I've had many of them myself. I've had spontaneous recalls. And when I met Sergey, I knew him. And together, we were together, at least one previous life with St. Francis. And Sergey is one of my brothers from the time when we were together with 2 other brothers that we now know. And St. Francis himself is reincarnated, and you're going to meet him in September.
Oh, we're looking forward to that.
At the same place where we met at a scene this fall. And to me, this is also part of the whole. It's recognizing these interconnections. And one of my favorite statements from Edgar Cayce is, you never walk down the street and pass someone you haven't known in a previous life. So if it's a problem, it's a chance to clean up old unfinished business. And if it's not a problem, it's a chance to redo friendships.
Yeah.
Absolutely.
What a fantastic meeting we're having. What a fantastic, wonderful group of people. And what a fantastic way to conclude this.
Absolutely.
Thank you.
Thank you.
Nice.
The end.
The end.
Good.